the meeting until the very end. After the introductions, Rochelle Kivanovsky, our moderator, will introduce the presenters. After that, Rochelle will ask the questions that people submitted when they registered. If a question occurs to you during the presentation, please write it down in the Zoom chat column. Those questions will be asked after the submitted ones. Then we will open up the meeting to live questions. Please keep them to a minute. To unmute yourself at that time, use *6 or unmute your phone. Play nicely and take turns. Beware, the muter-in-chief will cut people off if they go on too long or ask. Sorry, but as there is great many people participating, we are doing everything we can to keep things as orderly as possible. Remember, this isn't a good space for questions that are not of general interest. Please ensure your phone or computer is on mute if not speaking to limit background noise. And then if on the phone, use *6 to mute. And now I turn it over to Rochelle. Thank you, everybody. I'm so glad you're here.
Hello, everybody. It's really nice that you were all able to make it tonight, and we're really very happy to have this opportunity to speak with everyone. And it's my distinct privilege now to introduce the panel of presenters who will each speak very briefly about their topic. And they are an amazing group of highly experienced, highly knowledgeable individuals. The first speaker is Tom McAlvanah, who's the Executive Director of the Interagency Council of Developmental Disabilities. Many of you here, I'm sure, know him. IAC is a membership organization of nearly 130 members whose missions are to provide education, supports, and services to children and adults with intellectual and developmental disabilities. Tom has been in the field for over 40 years, beginning as a DSP and progressing through managerial and administrative positions to executive staff. And he was employed for 33 years by LifeSpire, where he honed his experience in government relations, financial management, program delivery, and personnel supervision. Our next speaker will be Jim Moran, again, who many people here know. Jim is the Chief Executive Officer of CareDesign of New York, which is a care coordination organization providing care management services to a membership of about 27,000 individuals with IDD in 7 counties in New York State. Jim also represents CareDesign in a collaborative of all the care coordination organizations in New York State who've been working together to best serve the needs of their members during this current pandemic. Prior to becoming CEO of CareDesign, Jim has worked with CP associations of New York State in strategic analysis and policy development. And notably, he also worked in state government for 32 years, with 32 years working at OPWDD, and served as Executive Deputy Commissioner his last 3 years with the agency. Jim will be followed by Susan Constantino. Susan is the President and CEO of Constructive Partnerships Unlimited and Cerebral Palsy Associations of New York State. She has a career spanning close to 40 years advocating for and working to enrich lives of people with disabilities and their families, and delivers services to a membership network of 24 affiliate agencies in the state. Susan is a founding member of New York Disability Advocates, a founding member of Access, a national organization, and is also responsible for the Metro Community Health Centers here in New York City. Linda Schellenberg is the Director of Community Services at the Center for Family Support and their subsidiary, CFS Self-Directed Supports, which is a fiscal intermediary. Linda participates in the Fiscal Intermediary Provider Network and is involved with self-direction advocacy efforts. And last but by no means least is BJ Stasio. BJ is the President of the Board of Directors of the Self-Advocacy Association of New York, SANYS, a position to which he was elected by his fellow self-advocates and peers around New York. He has also been employed by OPWDD for over 20 years, working on person-centered planning, voting issues, and self-determination training and education. Additionally, he has served on the board of National Federation for Just Communities of Western New York, the Disability History Museum Board, and has his own nonprofit organization, Buffalo Racing, focused on getting people with disabilities involved in 5K races. BJ has been actively involved with direct advocacy to OPWDD during this public health crisis on behalf of SANYS, representing the voices of self-advocates across New York State. So I think you'll agree with me. We have a very, very knowledgeable and seasoned panel. And with that, Tom, will you start us off?
Sure. Thank you, Thank you for that great introduction. I hope I can live up to all those great words that were said, especially the rest of you fellow panel members. So, but thank you for that, Rich. You know, as I know we have just 3 minutes, so I will try and be as cogent as I can, and also kind of capture a few things that possibly will lead to questions. I saw some of the online questions that were sent, so we kind of have an idea where we're going. I think we are all weary. We are mentally tired. We are worried, but we're still standing. Some of us, all of us are pretty wobbly at this particular point. So how do we look at the state of where we are? So I decided that since as we look at people are home and people are watching, and the even TV programming is all upside down. They're putting a lot of old movies on. So I thought of one that may be best to kind of capture some things that you would want to hear. So I'm going to call it the good, the bad, and the ugly. Certainly, to start off, I think it was mentioned that what an amazing job so many of you parents are doing with your lives being upside down, and some of you have taken folks that may have been living in a residential facility. Some of you have folks home every day. They're not going to program. It is difficult for anybody to go through those circumstances, and you have responded. I think the other part of the good is for the folks that are working in our certified residences, our staff. Those are our heroes. I'm now seeing more and more signs that say on the outside, heroes work here. You see it outside in front of hospitals, but I'm seeing it in front of residences as well. The organizations have responded. It has not been perfect by any means. I think we have tried to create the best out of a really awful situation. When individuals were getting sick and needed to go to the ERs or go to a hospital, we got them there as best as possible. We created some isolation or quarantine rooms as we could, either in the residences when it was possible. Many of the organizations, not waiting for OPWDD, mind you, found space in their residences or in maybe an unoccupied bedroom or an unoccupied residence unopened to be able to provide proper quarantine. In addition, I think it took a long time, but without waiting for government, we were able to get supplies of PPEs, and finally government did respond, and it was the New York City Department of Health and Mental Hygiene who for the last month now have been sending donated, or certainly just donating to us, PPE supplies for our agencies. And the supply chains are starting to loosen up, so that is a good sign. And finally, on the good side, I think that we as a community have been coming together, and certainly from the provider associations and CCOs, we have been working and pretty much in the same direction in terms of our advocacy push. We've been working with our lobbyists to help bring positive press to some awful situations and showing the plight of the homes and the individuals and the folks who are there. Certainly the bad is pretty clear, and you can start with those individuals who we have lost. I think the count in New York State today, in terms of people who have passed away from the virus, is 23,083. 392 individuals we just heard today, individuals with intellectual and developmental disabilities, have passed away as a result of a positive COVID virus. There was 2,600 individuals who were positive cases statewide, and about 2,148 were in certified residences. And of course, nearly 90% has been consistent, have been in the downstate area. So certainly that has been a real trying and challenge. And of course, what we're now starting to see is that now 300 school children have been sickened by this infection related to COVID-19. As for OPWDD, I think their response has been spotty at best. There was never a broad strategy, I think, from early on, for example, for the PPEs. There is no broad-based strategy for testing. There's no broad-based strategy for reopening as we speak. I know many of the families now who are on the stakeholder calls ask these questions constantly, and we keep getting, well, we'll look into that, or yes, understood the situation that you have with fiscal intermediaries, et cetera. And it's extremely frustrating to listen to that. Certainly there's lots of guidance out there. They continue to take more of a backseat to whatever DOH says. Again, part of that may be their inability to advocate. Part of it may be the fact that the Executive Chamber and Department of Health have a firm hold on what gets said and what doesn't get said. Either way, we sometimes feel as if, as providers, and I know you do as families, that you have to take things in your own hands to get anything done. And lastly, I think in terms of the ugly, and I think that's the big ugly, is the economy, both on the federal level and state level, and certainly as far as we're concerned, the mental hygiene budget. We are certainly wondering what this is going to look like as we go forward. For those of us in the New York City, Region 1, we have a new fiscal year coming July 1, and what is that going to look like? It has taken forever for New York State to work with CMS to provide the kind of funding support for the day rehabilitation programs. As you all know, the retainer day program. I won't get into the, we will not get into the what and when and how and why or any of that at this particular point. But certainly, you know, we recognize the fact that we are in a very fragile state. New York Disability Advocates, who's pretty much a coalition of 7 statewide provider associations, point out that now 41% of provider agencies have less than 30 days cash on hand because of the significant COVID-related expenses. Our increase of the spending on PPEs has been over $9.3 million in a six-week period between March 1 and April 15th. Program revenue is down. The cash on hand is not there. So we have a lot to continue to try and work with and to try and help get us back on a track that will get us reopened and stable. But we're still going to have an awful lot of advocacy work. We're going to have to keep an eye on Washington, and we're going to have to continue to push Albany to do the right thing. It may have been a little over 3 minutes, but I'll stop there.
Thanks very much, Tom. That was very informative. And now can we move on to Jim, please? Are you ready?
Sure, Rochelle. Thank you. Hi, everybody. And I hope this finds everybody safe and well. And I just wanted to cover some highlights. Tom went through a lot of information, so I'm not going to repeat any of that. So I'll talk to you a little bit about what the CCOs have been doing together. I think the good news is that, you know, with all of the challenges with getting the CCOs up and running and trying to be on the same page as much as possible, we really have been collaborating for quite a while. And I think the pandemic has brought the CCOs even closer, trying to ensure that we're navigating this, trying as much as possible to use the same methods and protocols in reaching out to the 107,000 members of the CCOs statewide. And I think we've done a fairly good job. You know, we started with developing an assessment tool, particularly since of the roughly 107,000, you know, about 70,000 folks or so live in the community at large, either with families or with independently or living with others. And obviously, you know, in our initial thinking around that was that those are the first groups that we really needed to reach out to, recognizing that the residential service providers, you know, had things in hand relative to dealing with the folks in the group homes. So we kind of, you know, prioritized working with the community folks first, as all of us did that together. So we worked on the assessment tool, which we've shared with, actually we've shared publicly. We've also shared obviously this with OPWDD. We've given OPWDD the results of those assessments. And we continue to update the assessments relative to how things are going. The assessment really looked at a couple of key things. One is the ability for if their folks are living with their family, what's their plan relative to what's the backup plan should something happen to the primary support that the individual had. We also looked at services that were needed and whether to how they could be obtained, and we also looked at resources relative to particularly around food at the time, short supply of certain things, and what we could do to be identifying those and try to do our best to support individuals and families. Has been our priority, and have been doing that. We then follow that with and that was all done within less than roughly 2 weeks of when things started. And then subsequent, we have reached out to all the folks in the group homes, which was very challenging, obviously in the downstate area because there was a lot going on. So some of that has been we've been working through with each residential provider, how best to do that as we check on how everybody is doing. So out of this, it comes that, we continue to work and following up with people on a regular basis, and have ongoing, engagement on that. The other thing that each of us have done, and we've spent a lot of time communicating, our websites have, lots of information. I haven't checked out everybody's website, but I know from CareDesign, we've made this a very, high priority. We engage in weekly webinars. We had been doing twice a week. We think it's important to be hearing directly from members and families and trying to deal with the issues and challenges that they speak to. I think one of the positive things that has come out of this, and Tom kind of mentioned a little bit about it, but I want to expand on it, and that is the relationship that I think we've been able to form both with the provider associations, service providers, and quite honestly, I think families and self-advocates. I think that, we have spent a lot of time together trying to work through the challenges because, as Tom said, not a lot of answers have been forthcoming. So we feel we've got to take it upon ourselves to work together, work with our members, our families, to really push the agenda forward. Advocacy has been strong. I think that everybody feels supported. At least I hope they do. I mean, I think we've done, we listen, and I think we've done our best to continue to put in front of OPWDD, the governor's office, and whoever else will listen to us, the challenges. I think the advocates were relentless on getting the policy, which was ridiculous that we had a fight to get a policy on ER and hospitalization visits. And it took us weeks to get that in play, but it was the combination of everybody working together on that made that happen. Same thing around PPE. If we waited for the state to support us on that effort, if it wasn't for the work done by the provider associations, working collaboratively with each other, and quite honestly, in many cases, local government, we would not be in as better shape with PPE than we are now. And I know Tom McAlvanah himself was personally kind of a champion on that and coordinated a lot of that activity. So kudos to Tom. And also the same issue for those who self-direct, right? How to get PPE. The state has still yet to issue guidance on self-direction, which we have been all over them about. The need for that, it still isn't there, but we keep pushing hard on that. I think a lot of the work we continue to do, I think what it shows that we can do things together. And sometimes it's despite, government, and I was a long-term, employee at OPWDD. We cannot assume OPW or any other governmental entity. It's always about reaction, not being proactive. So I think we have to, working together with all of you, and my hat goes off to the families and self-advocates for being able to get this far in this process. This has been, I cannot imagine I hear it in voices when we have our webinars. My heart goes out to all of you who either have brought your loved ones home and trying to deal with, you know, all of the other limitations in life that have happened to everybody. But my heart goes out to all of you, and try to put myself in your shoes, which I can really not do, but doing everything that I think the CCOs and particularly CareDesign can do to support the effort here. So thank you. I really appreciate the opportunity to speak to you all tonight.
Thanks so much, Jim. And we appreciate your comments. Next, we're going to move on to Susan Constantino. Susan? Is Susan here?
There. Now, can you hear me?
Yes, we can.
Okay, great. Thank you. I'm sorry. You would think we would all be used to doing all of this and knowing that we have to mute and unmute ourselves all the time with all the time we spend on Zoom and on our computers. Firstly, I'd like to say thank you for having me here today. I really appreciate having the opportunity to talk about some of what has gone on over the last couple of months as it's related to the providers. And Tom went into a great deal of it, as did Jim. And what I would really like to start with is firstly the families. We'd like to thank all the families for really being so supportive of the providers. This has been very difficult for all of us. We've all had a learning curve that has been, you know, by immersion right into what it was. I will tell you that our government partner, OPWDD, has not been a good partner in this, and I know we'll talk more about it later. As Jim said, most of it they haven't been the leaders. We actually have had the family members and the providers and the CCOs who have really led this. And I think that the one thing that you can feel confident about is that we don't know how to do it all, but we're more than willing to learn. And that's what we've had to do, sort of like learn by immersion here. I think that when this started, the providers had asked clearly if we could have day programs stop because we felt that bringing all the people together wasn't good. OPWDD had a hard time, and it took them a couple weeks to catch up to the fact that we needed to do that. That put us sort of in the heart of what we needed to do to make decisions, because our first and foremost goal, and every provider will tell you this if you ask, what's the first and foremost goal today? It's keeping people safe and keeping them healthy. And that was actually how we started. And I believe that everything that we did was to get to that particular goal. We had, as you know, before this started, we already had a staffing crisis. And now we had a staffing crisis in the sense that we had staff who were scared. And they had every reason to be scared. This was something none of us knew anything about. And part of what we needed to do was to continue to keep their spirits up, to continue to tell them, as Tom said, that they're heroes, and continue to be able to reward them for everything that they were doing for the folks, because they are the people. Our direct support staff, our nursing staff in our homes, and our middle managers in our homes have worked untold hours to keep people safe. I believe that with no support from OPWDD or the government, the agencies have all paid people hazard pay, or most of them have, I'm sure. They've done everything they can to think about how to reward the folks who have really stood by the people who we support and the people we care about. We had to make a very hard decision in the very beginning, and that was to have no one come into our homes except the staff. And to have to tell families that they couldn't come and visit was an extremely difficult thing for us to do. And we really are, and as we talk further on, I'm sure you'll see how we are really trying to now begin to look at how to do some of that differently so that we can bring families and their family members together. We're going forward, looking forward. I think that even though we talked about the 392 deaths and the numbers today of the folks who've tested positive, those numbers, the positives are going down. We have bent the curve, and now we're looking to how do we begin to think about living again in a world where not everyone understands social distancing. Not everyone understands having to wear face coverings. Not everyone understands why they haven't seen their family members. But how do we start to get the world to be a little normal for them? And that's where I think the providers have their minds and their hearts set now on trying to do this reentry in the right way. Thank you.
Thank you very much, Susan. Next, we're going to hear from, excuse me, from Linda Schellenberg from the perspective of a fiscal intermediary and self-direction.
Hi, thank you for having me. It is quite an honor. What a large group. It's wonderful to see. So there were a few questions, but I did want to just start by saying I really do appreciate wholeheartedly all of the families and all that you're doing right now, just really going above and beyond. And I hope you're taking a breath when you can to help take care of yourself as well, and continue to reach out to us for help. I also appreciate participating and reading all the information that parents are sharing on the various listservs so that I can continue to support those advocacy efforts. We don't always know what we don't know, so it's really important that you continue to share those things that are important to you. The first thing I wanted to just touch on is the PPE issue. So it has been unclear. There has not been any official guidance on PPE and funding for PPE for the FIs. It was said people can use their own individualized budgets to purchase, but an individual family being able to purchase PPE has been difficult, and it is complicated. And a lot of the FIs feel, as we are the employer of record, we do need to supply the staff with PPE. In addition, a lot of FIs, there's different approach to providing PPE. I know for us, we have been sending PPE in the mail. We've been sending what we have, reusable mask, a surgical mask, gloves. But we continue to advocate with OPWDD to give us guidance on how to fund the PPE and how to get it to you guys in a timely fashion. So that is something that's on our forefront. The other thing is families are starting to gradually, what I've noticed is starting to gradually resume service face-to-face. We've been talking to folks on an individualized basis so they can make a decision that's best for themselves. Assessing their level of risk and comfort in bringing staff back in, whether it be for a few hours or more, and talking to them and the staff about how to resume services in a safe way. An issue has come up where some families are saying they want the staff to be tested, and we're just trying to figure that out as well. We do not have any guidance. I was hoping to get some guidance today to share with you. I don't have anything official about retainer funds for the self-hired staff. As you know, there is retainer funding available for direct provider, ComHab and DayHab, but there's not for self-hired ComHab. So many of the self-hired staff are on unemployment. And another big issue is families have been told by the SD liaisons that they cannot seek additional services at this time. So this is a real new issue that we're trying to get clarification on, and I'm hoping that we will get a response to that quickly. Another advocacy point that many families have brought up, and actually one of the parents that's on the call today shared that CMS put out a recommendation to states to consider allowing parents to be paid as caregivers. So that is something that we have shared also with OPWDD, and we hope that they will give some advice on that and consideration to doing that. Thank you.
Thank you very much, Linda. And now we will hear from BJ Stasio, who will speak to us about the impact on individuals of the pandemic. BJ?
Hey, thank you. I'm going to give you a brief update on the work SANYS has done in collaboration with families and other stakeholders. early on, SANYS put together two documents, two summaries of OPWDD guidance in easy read formats. They have either gone out or will go out through each region. They are also being shared by social media and going up on the SANYS website. And the changes in care planning requirements, I will tell you, just as an aside, I've heard more from my care coordinator at this point during COVID, anytime that I've worked with her, and it's been an interesting experience even for me. The other is about how people are to get PPE. We also advocated heavily with OPWDD to set a clear standard for people in self-determination to get PPE for themselves and staff. And our previous speaker was right. It can be very confusing and very frustrating to get the answers you want from OPW, but that's why we're all advocating. We have been advocating regularly with OPWDD on the following issues. We pushed OPWDD to create a plain language guide on COVID-19 and asking them to continue publishing documents in plain language. We worked with family advocates to issue the DOH guidance, supporting the federal guidance against non-discrimination. We are also advocating for OPWDD to release standards for testing both people served and staff, especially in group homes where the risk of spread is most high. We also push for OPWDD to share more data about how many people are affected and ask that they use the data to make necessary changes to keep people as safe as possible. And recently we asked OPWDD to focus on making their reopening plans person-centered, because that's what the system should be all about, right? We and family advocates have asked a number of times for OPWDD to issue the process by which people in self-determination can apply for retainer payments for their staff. And it's been really good to have the opportunity to hear from advocates over Zoom. We hold weekly stakeholder meetings, statewide calls, and each region has calls. And I don't want to forget to say that the parent groups have worked with SANYS to ask DOH to have hospital guidance for staff and family to visit them while they were in the hospital. And that was good to see that things got done if we all work together. And I hope we continue to work together. Thank you.
Thanks very much, BJ, and thank you for sticking to your time limits too.
Hey, I practiced.
You did, I can tell. I can tell. So what we're going to do now is ask the speakers to address some of the questions that came through to our website during the registration process, and remind everyone that after that we will also be taking questions that are appearing on the chat now. And after that, we will be taking spontaneous questions, including from those on the people who are on the phone. Okay. So the first question is, what is the status of funding for services? More specifically, what is happening with funding for providers and payments to DSPs for services? And are the DSPs receiving hazard pay, which I think that Susan did address to some extent. But Tom, do you want to talk a little bit more generally about the status of the funding for services right now and where some of the issues are? Or anyone else want to take this?
While we're waiting for Tom, I don't mind beginning it, Rochelle. As we had said before, OPWDD has no sense of any kind of urgency with anything for providers. So providers have been paid for their residential programs as expected. Day programs, we got 1 month of a retainer payment, and we're assuming that within the next few days we should begin to perhaps get a second retainer payment that would in fact take us until the end of the emergency for day program. So that was helpful. They had promised us an enhanced rate for our residential programs, but then DOB would not, the Division of Budget would not approve the enhanced rate. So many weeks later, we are being told that we can bill for community HAB for that. We also will be paid for community HAB. However, I did see from one of the chat room questions, it asked about retainer days for respite. There is no retainer for respite. They had been pretty clear that they were not going to be able to do that. Respite they had wanted to. They had tried to get that into the retainer day payment, but they were unable to do that. So for respite, there is no retainer day payment that can be given to a provider. So as you can see, it's spotty. I think that it is a little hard for the providers to be able to plan or to know what their cash is going to be. That's a really difficult part for providers. But as I had said before, I believe that the majority of providers are paying hazard pay. I know some are paying double pay. Some are paying extra amounts per hour. Everyone has tried to come up with a formula so that they would have a way to be able to do this. We know that we will very likely not get reimbursed for those dollars. So exactly where or how we are going to be able to do it, I'm not certain. As Tom mentioned before, providers didn't go into this being in the best of financial shape. And we're really concerned that after this, that we are going to obviously be in worse shape. But what we did know, and I think that this was very clear from every provider, having staff there to do what needed to be done, to show up, to be able to give the care was the most important piece. And we needed that staff on all shifts. There were stories that were true stories, but the stories of hospitals that brought people back to their residences at 3 o'clock in the morning, and you had to have staff there that were capable of doing what needed to be done. So agencies have spent a lot of money. They spent a lot of money on PPE. It's only at the very end that we have been able to at all be able to get PPE from the local health department, as Thomas said, just pretty much in New York City. So agencies will, when we have time to really sit down and look at where our finances are, they're not going to be very good, but we will have spent what we needed to spend in order to keep people safe.
Hey, I finally found the unmute. So my apologies. I like Susan, you'd think now we'd figure this thing out already. But she did a great job, so I'm not going to extend it other than I think part of what is looming, in addition to the snail's pace of OPWDD getting the retainer payments ready to go so that providers can actually have some level of steady source of income. There's an awful lot of dollars that are associated in the properties and the mortgages and leases that we have for these properties in our day services, and what that's going to look like as we go forward is quite troublesome. Certainly this government is looking to the federal government because they, the potential HEROES Act that was passed in the House last week, we may not be able to get most of it. Certainly not all as it is written, but I know that many state and local governments are, not just New York State, is depending upon some form of relief for that. And any kind of relief that we can get from the federal government is going to take a lot of the pressure off of us. We are still looking at a 2% cut that was proposed, not in part of the budget, but it's part of OPWDD spending plan. That's an across-the-board cut effective July 1. They're not speaking to any of it right now, and cash is extremely tight up there. Nothing has been released. Even the raises for the DSP staff that were due in January and in April have still not been released. They told us today on the phone that it was going to, that it's getting there, but this will tell you the level of difficulty that they are in up there.
Thank you both very much. I think the next question that we had was what OPWDD services are available now? That's one question. And also what are care coordinators doing during this time? But I think we should start with, do we know, besides, we know residential is available, we know some virtual activities are available through day programs and ComHab, but it seems on a somewhat limited basis. Are there any other programs that OPWDD is offering at this point?
This is Susan. They're offering still pre-voc programs. Although again, you know, it's more difficult to be able to do them. We are seeing now with DayHab, we're seeing many, many more activities going on. I think providers have gotten much more adept at being able to use the video and to be able to do that. So that part has been really, really good. I believe that as I'm trying to think through all of what else is there, it is really not very much. I think that most of it is whatever we can do out of the residential program. So Tom or Jim, I'm going to ask you, but those are the main programs that we see happening right now.
Correct. I think that's absolutely correct, Susan. So what that tells you, there's not a lot of support, particularly for families who have loved ones at home, which is very devastating, very challenging. I know some families are starting to, again, depending upon where you are in the state, to, you know, soften on that a little bit in terms of with the right protocols on that point. But do you want me to speak to the care coordinators quickly? I mean, I kind of covered it in my opening remarks. You know, they continue to focus on the people that they support, and making sure that if there's issues, concerns, that if something they can't handle, that it gets elevated in the organization. And, you know, quite honestly, there's times when I've had to be involved in certain issues myself, because we weren't getting somewhere on the issues. And, you know, as an organization, I think we have spent a lot of time trying to help interpret. You know, we've worked closely with, you know, Jim has been involved in some discussions, Jim Karp, and BJ and Alan and Arnold and a couple other parent groups, just trying to, you know, make way with all of this. So we've developed some things around benefits, to try to be useful tools for families, individuals and families. We've tried to do an interpretation of the K waiver because it gets complicated when you look at retainer payments and what does all this mean to members and families. So we've tried to explain that in a way that we hope is written in a way that people help you understand what it is. We've also spent some time starting to think about, I called it reopening. It's really, you know, in many cases it is reopening because services have stopped, of what are the things everybody needs to think about as we look at this, and individuals and families have to be at the center of all of that. And as BJ said, person-centered, you know, has to be the focus of that. One of the couple of things that we want to spend more time on, because we're not getting direction from the state, is on testing and visitation. Those aren't mutually exclusive. So we really want to work to come up with best practices around all of this. And we really want to collaborate on this with the providers and with the other CCOs to really to help, you know, move things forward. The last question, I think, as part of that was on what's going on with graduates. One of the problems we have seen as CCOs, since we're responsible for intake, is even though, despite what OPW has said about, you know, concern about graduates, we have had some issues with a number of the DDROs relative to people getting enrolled. Obviously, you know, if families are going to have concerns about what happens with graduates, well, you're going to be looking primarily for some sort of day activity. If day programs are not open, and there are alternatives, but then you're still into the situation where you know, what's going to be available to people, just like now with schools not being open, we're going to have probably the same challenges. But right now we are having pockets of problems with OPWDD relative to getting people enrolled. So we are working directly with Abiba Kindo from OPW on this issue, because we need to get people enrolled, first of all in CCO, and then secondly into services.
Thank you very much.
Hi, this is Tom. I just want to add one quick thing. Jim is absolutely right. I want everyone to know that the 5 borough-wide DD councils put together a letter from all of them to OPW on the crisis and the deep concern for the hundreds of 2020 education graduates from the 53s, the ACES program, and District 75. And so one of the things is, as Jim mentioned, with day habs continuing to be closed, what are some options? Would SED, for example, consider postponing graduation so students can remain in school for an additional year to address those and to allow some continuity? Or would OPWDD have a COVID-19 waiver to provide some temporary presumptive eligibility based on prior testing and adaptive functioning? So we put these questions to Abiba. She's this past last week. So OPWDD is supposedly looking into it. So we hope to get an answer on that soon, because there's an awful lot of families and individuals whose July hangs in the balance. So we'll let everybody know when we get there.
Clearly, this transition issue is very critical for many families. Another questioner wanted to know, how do I go about receiving help in my home, specifically PPE? Now, I know that Linda addressed it from the self-direction and FI perspective, but what about other individuals in the community? How can they get appropriate PPE? Please unmute yourself if you want to speak.
So, Rochelle, I can speak a little bit to that. The one thing that OPW recently was able to get, apparently the state got a donation from the Haynes Company for face coverings. Each CCO, the DDROs have these available to them, as well as a number were sent to the CCOs around the state. I can tell you, I think CareDesign, I think there were, I can only speak for the numbers for CareDesign. I believe we got something like 53,000 face coverings, something like that. And we have them, most of them right now we've had sent to our main office, which we then will ship out to people as people look for those. Those are just face coverings. These are not, you know, what I would say, if you're looking for true protective equipment, that's not something that the CCOs have in hand. But we, like I say, we do have these face coverings, which we're willing to mail out to families. The care managers are working, making sure their families are aware of the availability of these face coverings and members, so that if they need access to those, we can provide those to them. But that's all I'm aware of is available at this point. And I don't know if the provider, from the provider side, Susan or Tom, you have something to add to that.
I don't, Jim, except as we had spoken earlier, you know, if there were particular families that asked us for that they needed it for something, that particularly for anyone who lived in our home, but the family had taken their family member home during this time, you know, we would be happy to be able to provide it. In the very beginning, we couldn't provide it to anyone because there wasn't enough to provide even to our own staff with the PPEs. And it was a terrible situation. But over the last few weeks, things have really improved dramatically. And so we would be able to help families who needed it if we knew where they were, or if they called or whatever, called the residence where their child lived or something, we would be able to do that. and I think most providers would now. Also, the thing that has been good is that everything that we didn't know downstate that we learned as we went along, anyone who's upstate has really gotten the benefit of our lessons that we did. So we know that upstate that it's easier for families because people are able to, they have enough PPE and they are able to provide things. So we do know that that's been we've been a model for them, and that's been a good thing for those families upstate.
Hi, it's Linda. I just wanted to tell you that New York City has free face coverings available. I just put in the chat thread that there are locations that people can go if they want to get free face coverings.
Thank you. On a different tack, a questioner asked, some providers are setting up Zoom sessions during this time. Are we required to be on all Zoom meetings, or can we pick and choose? I guess they're referring to DayHab and ComHab Zoom meetings.
Yeah.
No requirement.
Yeah, I don't think there's ever a requirement. No.
Okay. So they can decide which ones they want to participate.
Whatever support that is needed to help someone who might need that, but other than that, there's no requirement for sure.
Right. But the one of the services that I forgot to mention when I was speaking about the services is really Article 16 clinic services, and some of that is counseling. So that is available, and it is available on Zoom or on some other kind of telehealth visit. And so families, we hope, are starting to get the notice that they can do this, that there are clinics that are willing to see, that are not only willing, that want to come in and perform all of their regular appointments and whatever. So we hope that that families are getting more comfortable with it, so that the folks can get the services that they would ordinarily have gotten out in an Article 16 clinic or a regular clinic.
Okay, thank you. That is very important information. The next set of questions focus more on residential issues. This is the $64,000 question. When do you expect visits will resume for residences?
I will take like the first crack at it, and then I would ask other people to join in. There is no date. There is really no date. I think if any of you had seen the letter from the commissioner that came out yesterday, it seemed to be a few weeks late, but it certainly did say that there were, that we were going to still do what we've been doing with people coming up close to windows and all that. We know that that's not good enough, and we know that families are really concerned. As Jim had mentioned, and a number of providers are putting together protocol right now as the weather has gotten better. We are hoping to have a protocol in place in the next week that will allow families to at least come, have PPE available for them, let them be 6 or 8 feet away from their individual who may be in the backyard or on a deck or whatever. Now, a lot of this is very difficult in the city because we don't have that everywhere, but we are trying to find different ways to be able to support this. But as Jim had mentioned, the hospitals are now starting pilot programs on bringing visitors in. And so that's supposed to be a 2-week pilot is my understanding, and then they'll see what happens after that. So if the hospitals open up on some of it, then I'm assuming that we're going to be able to open up also on that. So hopefully very soon.
Any other opinions on this?
Any other opinions?
I would agree. I think that's probably right. And as various regions of the state open up and that phasing starts to happen, I think we'll start to see that more. I know that again, many of the families and self-advocates are pushing at these phone calls for OPW to have that kind of understanding that we need to get back to that. And there's ways to do it in a gradual way. So I think we'll start to see it relatively soon. But then again, that's what OPW says all the time. They say the word soon and it never comes. So I better not say it.
That's right.
Okay. And a couple of questions deal with infection control issues in the residences. So are there existing protocols and standards set for the use of PPE? We're happy to hear that there seems to be enough PPE now, but are there protocols and standards set? What happens when the hospital discharges someone who had COVID back to a residence? What are the protocols around that? And are families being informed when staff or other residents are infected? And so that's sort of a cluster of.
The last one is they are supposed to be, absolutely. They're supposed to communicate in writing to families. There was guidance that came out about that about three weeks ago or so. That the individuals, while there's certain confidential information about who may have contracted COVID-19, the fact that it is present in the residence, they're supposed to inform the families and in writing as to what they're doing about it. In terms of protocols and standards, the CDC has guidance for congregate care facilities. New York City Department of Health and Mental Hygiene also has very helpful guidance for use of PPEs. There's a whole formula that you can follow in terms of the exhaustion rate for PPEs and when you need to change them, et cetera. And the New York State Department of Health also has it, and it's on OPWDD's website. In terms of what guidance is available. So, and what was the other question was?
And what happens when the hospital discharges someone?
Well, that's been a tricky one. Susan, you've been working especially with the city on this one. I could take it, but I'll let you go with it. How's that?
No, I'd be happy to do that, Tom, and we have been working with the city on it. I would start back with all of these questions just to say that it was very difficult in the beginning for OPWDD to have that kind of guidance. And one of the things that the providers insisted upon is that we also be meeting with the public health, the public health section of the Department of Health, so that we got to be included as in the guidance that they were putting out for all of this stuff, for the PPEs and for informing families and informing residences and everyone if someone else in the house tested positive. So once we've got to be a part of that, that became a much more uniform way for us to get the information. In the very beginning, the hospitals were not very good about, once the hospitals started to get overwhelmed. In the very beginning, they were fine. But as they got overwhelmed, they were in fact discharging individuals who were positive, and without any really good discharge orders. The providers had tried very many times to say, no, we can't take them back without orders. We can't take them back without having the right PPEs, the right the right place for quarantine, excuse me. I think that everyone had been well situated in terms of infection control. But again, you needed to have a place to quarantine or isolate, and many homes, as you know, or apartments in the city didn't have that. Again, we worked with OPWDD because they, on the other hand, would call us and say, you must take them back because the hospital needs to have them out. So I think what the residences did is, number one, they became very good at finding the isolation spot. They became extremely good if there was one bathroom in the house, if they had to bring someone back who might have still been positive because they hadn't been tested again, that they were very good at being able to do what they needed to do to disinfect the bathroom after every use. Our folks became very good at infection control. And many agencies, as you know, set up small little units in their day programs or in places where people weren't living at the time, so they had a place to isolate individuals. I believe that most of the protocols said that when an individual came home from the hospital, they had to be still in quarantine for 14 days because we didn't know, because they weren't tested, whether they were positive or not. So a lot of it is what medical directors around the city and the people who worked with us were doing for us. The city itself then became very involved with us, and that became a big turning point. They were giving us the opportunity to use isolation beds if we needed to. They were working on the standards with the hospital, and today I'm happy to say, because of the nursing home situation, which wasn't good, the people are not leaving the hospital who are positive. They're leaving when they are well, for the most part. So that piece has gotten better, and it's going to be the standard that we will be using, I hope, if there should be, and hopefully not a second wave of all of this. So it's better today than it was 5 weeks ago or 6.
That's very good news to hear. And
Absolutely, absolutely.
the last question along the infection control line is, what is happening with respect to testing of individuals and staff in the residences? And I guess there's also the issue of testing for the virus and testing for the antibodies.
Mhm, mhm. There's work with the city right now. Again, the same group in the city that Tom and I had worked with PPEs, and then had worked with hospitals in isolation, is also now beginning to look at all of the testing. Some of us have been lucky enough to work with our PPS in our area, who has helped us to set up testing. Everyone's goal, of course, is to get as much testing done as possible. And both of them are available. The city is making it very easy for us to be able to get testing for our staff now, they tell us. And so that's a really good piece. We have been working with Quest, and a number of agencies in the city are, so that we can get the swab test for all of our residences, and for everyone, for all of them, so that we will be able to know, and then be able to take the appropriate action. It's not good yet. There are still, most residences are not. The staff that still have been tested are primarily those who have had the symptoms, but it's getting better. It's getting actually much better. And it is for both of them. Both of the tests are available. And so again, 3 weeks ago, it wasn't good. Each week it gets a little bit better with people who are able to be tested. And that has been a big plus.
The only thing I would add is that many of our agencies have been pretty resilient and have been able to find testing. You know, the many agencies in Staten Island, for example, were able to go to the site and do the drive-through testing. Many of these others in Queens and Nassau also went to testing sites. City MD now has testing, even for antibodies. So we were hoping to get a more comprehensive approach by OPW. Again, they have, like many things, have taken a back seat to what the departments of health are doing. So, but I think, as Susan said, as we go on, as the weeks go by, it is getting better, and I think we're going to have a better strategy come the summer.
Yep.
Okay. The next few questions deal with self-direction, so I assume they're for Linda. How do you put together a self-direction plan for someone who's graduating? Is the first one.
The standard way would be the same now, where you would, go through the whole process to participate in self-direction if you're not already. The catch is what we're hearing for somebody who's already receiving self-directed services. The liaisons are not authorizing increased budget amounts at this point in time. We're trying to get something in writing to clarify that point and why that is. And we've specifically said to OPWDD, this doesn't make sense for somebody who is graduating. They're going to need to use additional funding in their budget to support their adult services. So that, this is a point of advocacy that needs to be made, and my hope is that this will be resolved quickly, so that as folks are transitioning this summer, a plan can be in place. I do want to point out the benefit to self-direction and ComHab and REST, but if you have individualized services, at this point, a lot of the families feel more comfortable, and that the risk is lessened lessened when you're having one staff supporting your son or daughter. So for families that are looking for alternatives to group day programs during this time, self-directed ComHab could be something to consider. I hope that answers the question.
Thank you. And actually, I think you already addressed the other question, which is, can parents now assisting their family member be paid from the self-direction budget? But I think you said that's under discussion. So
Yes.
Another question that came up is, what is being done now, or is anything being done now to press OPWDD and DOH to make the CAS and IM assessments available so that the individual, so that we can all see the items to make sure that critical information is included? Anybody know?
Are we talking about, on that, Rochelle, the question, is it about seeing the assessment itself?
Yes.
I'm not sure what.
I think it's about seeing the actual assessment, seeing the data items, and having.
Yeah, on the CAS, I don't know how many items there are. With the IM, it could be, I think there's like a substantial number of questions, but it's not as if some are only asked once you answer one question, then may lead to other questions. And so there's an ability to see it, but I don't, not all the questions would be applicable or appropriate. It really would depend. Plus, what we have done from the CCO perspective on the IAM is really, we've had the staff, while it is a tool, it is just that, and it's not the be all end all. And we look at it as, you have to do it in, first of all, a person-centered way. And some of the questions are not even appropriate that are on that assessment. Many families pointed that out to us, and we have trained the staff to be careful in terms of the questioning, the questions that they ask, because some of them are not even are appropriate. You're not going to ask a young child, do they have a burial plan, for example. I mean, that's a kind of a crazy, crazy one, but that's in fact on the thing. Do you sleep with your clothes on? I mean, some of these questions are really inappropriate, quite honestly. So we have talked to the staff and trained the staff to look at that. And if families have questions as they go, feel free to, talk to your care manager about it. This is not meant to be a hidden process. And it's really, the assessment is used to help inform the discussion around the development of a life plan. So it's not done in a way that suggests there's going to be any form of limitation as it relates to risk.
On this, Jim, I'm sorry if you don't mind, but I don't think the concern was how it's being implemented as much as someone really thought we should be able to see the questions. But at this point, that's, especially for the CAS, I don't think is on the table. So we don't have a lot of time left, so that's why I want to move forward to more, the questions from the audience. And first, to the people who are reviewing the chat, are there questions in the chat that should be raised? Lynn? No?
Where'd you go?
Some questions.
Should we go to live questions?
Mary, do you have questions from the chat?
No, I was just going to say, I think we could probably move on to live questions at this
Okay,
point.
so then let's move on to the live questions. People will note there is, for those who are on the chat, there is a raise, who are on video, you can see a raised hand. I
have a question.
Okay.
Hi, this is Ralph Warren, person getting services, and I wrote this thing about the CAS, so I don't really want to go at that, but give you an idea of why it's important that we see the items for medical, because I believe I have been impacted by this virus, and I'm getting testing. And I'm feedback on the phone. On 1 second.
Yeah, I just want to remind all the questions, you get 1 minute for your question because we really want.
Sorry, I was getting feedback on my phone. Okay, so my question is this: the most important thing here is that medical information related specifically to risk for the virus is not being adequately assessed. As a starting point, going back to what Jim Moran said in the beginning, you guys have turned over the risk assessment information to OPWDD. We need to see it as well. Will you send that out to us? Will you publish it so that we can see the results?
Well, I can only speak for CareDesign. I can't speak for the other CCOs, Ralph. And of course, whatever we would share, of course, would be depersonalized, information. But I have no trouble sharing, what we've seen overall from a CareDesign perspective. I have no problem sharing that information.
Right, but again, with any of these assessment information, we need essentially what we need is we need the actual aggregate data, not individual data, but all of the aggregate data.
Well, I can't commit to the other CCOs sharing their information. I can only commit to what CareDesign, is willing to do. I mean, I can talk to the other CCOs about sharing that, but that's, again, I can't make that decision. But I will speak to the other CCOs about what they're willing to share of the rolled up information.
Thank you.
Okay.
And we have a question from Amber.
Hi, I don't know. Sometimes there's feedback when people don't put themselves on mute. So that's why it's important to go on mute if you can. Might help all this. So my question really is about prevention. People are dying here, right? So I do think it's important to ask the question about a burial plan, actually, or a burial plot, whether it's to the individual themselves and they can discuss it, or with the family member. I also think that it's important to advocate for family members who have health home care management services through their CCO to be added to the consent form, assuming and hoping that one day the EHR that is available or the sharing of information that is available can be made available to family members and individuals themselves. So I'm just hoping that maybe we can push for that, because that seems like an easy thing to do. And I would love to know if any of the CCOs currently add family members to that global consent form or not. Thank you.
Anybody, I guess, Jim, that's you. You're the CCO.
Yeah, that's a good question. I don't want to answer that without having the right answer to that. I'd have to check with my team on that. I don't know the answer to that at the top of my head. So I don't want to say yay or nay without checking on that. But I will get that tomorrow and share that back to the group, and then you can put that out.
Thank you. We will disseminate it. Other questions from the audience?
Yes. Can I ask a question?
Sure.
Yes, this is Diane Jones. And my question is, as we go on and to reopen up the day have programs, how are we going to be able to have them separated if you're in a small facility of a day have program? How are we going to implement the 6 feet apart and the space that's needed, and to adequately have everybody? Are we going to do split shifts? There's a whole lot of questions in regards to that.
Thank you, Diane. I just want to remind people that we said in the beginning also that we're going to have a whole other forum discussing reopening issue. And that Jim also mentioned in the beginning that CareDesign is having meetings of the Family Advisory Board that's open to anyone who wants to be involved with that to discuss reopening issues from the family perspective as well. But I will, allow some answer to this right now because it is on everybody's mind and we need to discuss it, at least have the initial conversation.
Absolutely.
Thank you.
The one thing I would say is that what we have from the Department of Health, and we have to fill out as a provider, as a business or a provider or whatever, we really have to fill out a form which talks about exactly everything you said for every building that we occupy. How will you keep people 6 feet away? How will you sanitize the building? And you have to have a plan that you keep in that building that can be looked at by anyone at any time. So all of the providers are looking at this because they know they have to fill it out before the day program starts. All of your questions that you asked about are all the excellent questions that we're all asking ourselves, and that we would like to have some input from the families. We need to have input from OPWDD. Perhaps it's having the programs or quartering the programs or only coming a certain time. We don't really know that yet. And the only other thing I'll say, because I want to go on to other questions and we'll have a meeting on this, is that we have found that many of our folks, our individuals who live in our residences, don't want to go back to day. They're liking not having to get up in the middle, at 6 o'clock in the morning. They want a different kind of schedule. They like doing the things that they're doing with cooking and different kinds of things depending on what they're able to do in their homes. So I think this is a real question that we all, family members and agencies and the state, all need to ask ourselves is, what really do we want our day programs to look like? Now's our opportunity.
Jim, I know you have something you want to say, right?
Yeah, I just wanted to add, I think there's going to be, in all honesty, and I'm aware we have some programs that have 300 people going to it in a given day. I cannot imagine any program is going to open with the thought of 300 people. First of all, I think government's going to have a say in terms of how things can be occupied, number one. But number two, I think this is the opportunity to really start to, as Susan is saying, reimagining things, re-looking at things differently. And it really does start with the individuals and their interest and with families. I absolutely agree with Susan's points about we have to engage individuals and families in this discussion from the start, because the only way it's going to really work well on an individual level.
Okay, and I think, Tom, you wanted to add something?
I would just want to add that points are all well taken, and our day services providers are already meeting and looking at what we're calling Reimagining Day Services, where we may return to some form of what we are doing, but we also may integrate other activities that people are doing now. Susan mentioned we're also hearing that some individuals like the fact that they do not have to go out and get on a bus and go to a program and bring their lunch and come back. So we're seeing this, and there's going to be new models of services as we go. We're all talking about it. It's kind of early to kind of say what it's going to look like, but we're all kind of concerned, as you guys are, and all the day programs are going to be speaking to their families as well to see what they are comfortable with, and the individuals as well to ask them what they are comfortable with.
I think one questioner just sent me, perhaps it'll be our final question because we're at 8:24, but what is the number one thing that we parents should be advocating for now? Is it money from the federal government? Are there issues on the state level? Where can we help? Anybody?
This is Jim. I would argue, was BJ, were you going to say something, BJ?
Yes, I'll go
Go ahead,
first and you
BJ.
can follow.
Okay.
I think as Jim and our other speakers have said, we need to focus on reimagining the system and making it truly person-centered and not system-centered, and going back to the medical model, because that's the way it will work best for everybody.
Thank you. On general level of advocacy, what is it that we as family members can do to help get the services we need for our families?
Well, I would only just say that I do think that the advocacy on the federal level is going to be really important. Some of the things that have been happening since all of this, some of the regulations that have been loosened up a little bit from CMS that have allowed us to do things more through video or allowed us to do things differently, we'd like some of those to stay. So not going back to what it was. We'd like to get away from, these 15-minute segments of billing times and all of that. So I think advocacy on the federal level, number one, that the state gets money, because if it doesn't, we really will be in trouble. So that advocacy is extremely important. But also the advocacy on how do we really begin to look at what's the goodness of what we got out of the loosening up of regulations, and how can we use those to really develop what BJ just said, which is this person-centered program, not based on funding segments of time, but on what people need and want to do and what their life needs to be.
Well, this sounds like a very good note to end. One more point?
I just wanted to add one thing, Rochelle. I think the other thing is that we will, and obviously you'll hear from each of us, is keeping an eye on, let's say we do get federal money.
Hi, I'm just finishing up my meeting.
The
Okay.
question will, the
Okay, no,
question
you're
will
calling it
come
9.
around.
So I should be
Whoever's
finishing in
talking,
5
please
minutes.
mute.
All right,
Somebody,
bye-bye.
the issue is going to center around what happens to the dollars when they come to the state, and the governor's priorities with those dollars. So, I think each of us will work together in terms of the providers, provider associations, and hopefully the FIs on where that money goes, follow the money, as they would say, and how much of that's going to make its way into our system. And I think that's critical because, as Susan and Tom have said about the financial crunch, I know the CCOs are about to take about a 15% rate cut. Tom referenced the 2% cut, and that's before COVID and impact of COVID. So I think we're all, concerned about what happens to the financing relative to the dollars in our system, and trying to keep as many dollars in the system and not leave it and bring in new dollars at the same time. Thank you.
Thank you very much. So we're at the end of our meeting. I want to thank everyone for participating. I want to thank our presenters and for the wealth of knowledge, but detailed and breadth of knowledge that they brought to this discussion, and to all our participants for the questions that were submitted and for your attention. And we hope very much that you'll come to our next virtual open forum, where we'll be talking more about reopening issues, and also to keep looking at the New York City Fair Facebook page and Twitter feeds, because we can send you information about advocacy efforts and things that you can participate in to move this process forward. So thank you again, everybody, and we hope to see you again soon.
And check the handout. There's a lot of information on it.
That's right.
Happy to do it. Thank you for having us.
Thank you so much, guys.
Thank you.
Thank you.
Bye, everybody. Be well.
Bye. Be safe.
Bye.
Thank you, everyone. Thank you.
Take care.
Sayonara.
Yeah.
Thank you.